Hello friends. Yeah, this is the graphic representation of the thalamus. Now, if you look into the thalamus, directly going into the basic concept of it, suppose if this is the your brain stem, your cortex, your brain and brain cortex, and if this is your spinal cord and the body, all the fibers which are coming into the body don't directly go into the thalamus. They are not sorry, they don't directly go into the cortex. They need to relay after coming from the body. They need to relay. They need to relay in different nucleus of the thalamus, and from there they are going into the cortex. They from there they are going into the cortex. Now that basic concept you came to know. The first point about thalamus, introductory point, it is the relay station for all the sensory information. It's a relay station for all the sensory information except olfaction. That is an exception, that is olfaction. Second thing you have to remember is thalamus is a part of diencephalon. Thalamus is a part of diencephalon. Thalamus is a part of diencephalon. So those are the two introductory points for thalamus. Now after that, look, if this is something called as dots, this is called as lamina. This is called lamina. This is the one which is divides a different nucleus of the thalamus. The one nucleus which is coming dorsal to it is called as medial dorsal nucleus, and the nucleus which is coming ventral to it is called as ventral nucleus. It's called as ventral nucleus. Now, this is ventro. There is something called ventro-anterior. There is something called as ventrolateral, and there is something called as ventro-posterior nucleus. Ventro-posterior nucleus. I'll come to that later. Now, after this, one nucleus is anterior most nucleus is called as anterior nucleus, and one nucleus is posterior most. It is called as pulvinar nucleus. It is called as pulvinar nucleus. It is called as pulvinar nucleus. Pulvinar nucleus is called as pulvinar nucleus. Pulvinar nucleus. Antermost nucleus is called anterior nucleus, posterior is called pulvinar nucleus. One nucleus in the dorsal is called medial dorsal nucleus. One nucleus is ventral, is called ventral nucleus. And after this, you see there is two more nucleus called medial and lateral genucleate body. They are given a separate, they come in a separate category called as metathalamus. Now, this is ventral nucleus group. I told it is divided into different parts. One is called as ventro-anterior, one is called as ventro-lateral, and one more is called as ventro-posterior. Ventro-anterior, ventro-lateral, ventro-posterior. ALP, alkaline phosphate. Okay, it's ventro-anterior, ventro-lateral, and ventro-posterior nucleus. And this ventro-posterior nucleus is further divided into two more parts. That is ventro-posterior lateral and ventro-posterior medial. Ventro-posterior lateral and ventro-posterior medial. After this I have told you each nucleus has got an input, okay, and it has got an output. Okay, all these things have got an input and there's an output. There's an input and output to this, there's an input and output to this, there's an input and output to this, there's an input and output to this. Every nucleus has got input and output, but we are going to see all the important inputs and outputs. I told you all the fibers here, right? It's going into the what? Cortex, right? Definitely cortex. It should be output should be cortex only. Output should be cortex. Now after this, if you look into this carefully, there's a ventro-anterior, there's an input, output, input, output, input, output, and these three are more important to remember. Now, these two nucleus are mainly motor, okay, and these two nucleus are mainly, what is it? It is sensory, okay, it is sensory. These two are mainly sensory and these two are mainly motor. Now, output from this nucleus and output from this nucleus, I told it is motor, right? So output should be what? Which cortex? Motor cortex. It should be motor cortex. I told these two nucleus are sensory. These two nucleus are sensory. So output should be which cortex? It should be sensory cortex. So output for these two is motor cortex. Output for these two is sensory cortex. Now all you have to remember is what is the input to it. No, I told these two are motor. Okay, if it is motor, then there are only other than corticospinal, which are the motor things you know. One is basal ganglia is motor. One more is cerebellum is motor. Cerebellum is L in it. So cerebellum is actually getting giving its input to ventrolateral. So this is cerebellum. This is cerebellum. This is cerebellum, and this is basal ganglia. Basal ganglia. Basically, fibers from basal ganglia are coming into the ventro-anterior nucleus and then going into the motor cortex. Fibers from the cerebellum are coming into the ventrolateral nucleus and then going into the motor cortex. You got what are the inputs for these two nucleus, ventro-anterior and ventrolateral, and what are the outputs? Output is same, that is cerebral cortex. Now after this we need to know the input and output for ventro-posterior lateral and ventro-posterior medial. I have told you one point till now about these two nucleus, that is these two are what is that point I told you? I told these two are sensory. These two are sensory nucleus. These two are motor. These two are sensory. So if these two are sensory, the output should go to where? Which cortex? Motor. This was motor cortex. This should be sensory cortex. It should be sensory cortex. It should be sensory cortex. And the input for these two nucleus is interesting. Now see, this is VPL. L stands for lower limb. This is VPM. M stands for makeup. Okay, makeup. Okay. Now this is for lower limb. So the input are coming, which is a sensory tract which is taking fibers from upper limb, lower limb, everywhere. I told you only two important sensory tract. One is dorsal column, medial lemniscal system, and one more is spinothalamic system. These are the basic two what sensory tract. So input for ventroposterior lateral nucleus is coming from a spinothalamic nucleus, and one more tract is, that is dorsal column, medial lemniscal system. That's input to ventroposterior lateral, and output is going into what, cerebral cerebral sensory cortex. Now ventroposterior medial, I told this is L, so lower limb, spinothalamic and dorsal column, medial lemniscal system. This is from head and neck. This is from head and neck. This is from rest of the body, and this is from head and neck. This is from head and neck. So head and neck, how to remember? What is the sensation? This is the sensation from all the parts of body. This is sensation from the head and neck. And the one thing which brings the sensation from the head and neck, which cranial nerve carries sensation from the face, that is fifth cranial nerve. It is fifth cranial nerve, and output is going into where? Cerebral sensory cortex. Cerebral sensory cortex. I hope you have got all the differences between the different nucleus and the input and output. If you want to remember this L, VPL, L stands for limbs, so fibers from the limbs. VPM stands for, M stands for what? M stands for makeup. Okay, M stands for makeup. Okay, the girls do makeup, right? Yeah, they don't do makeup for the legs. Okay, some of them do, but yeah, this is much better. Ventroposterior medial nucleus. M stands for makeup, and makeup is done in the face, and the sensation from the face is carried by the trigeminal nerve. So output for these two is sensory cortex. Output for these two is motor cortex. Input for VA is coming from basal ganglia. Input for VL is coming from cerebellum. Input for VPL is coming from spinothalamic and dorsal column, medial lemniscal system, and input to ventroposterior medial nucleus is coming from trigeminal system. Trigeminal system. Further, few more points I would like to tell you. This you don't have to remember everything, input and output. I make it very simple. Medial dorsal nucleus is associated with the limbic system. And limbic system means is associated with the emotion. It's associated with the emotion. Now after this is something called as pulvinar nucleus. This is the posterior most nucleus called as the pulvinar nucleus, and you have to just remember the function of the pulvinar nucleus. That it is simply associated with the visual system. It is simply associated with the visual system. This is one point about each nucleus is more than enough. These nucleus you need to know in detail. Okay, and this you have to just remember is associated with the visual system, and this is associated with the limbic system and emotion. Anterior nucleus, the mnemonic is MAC. Okay, the mnemonic is MAC. MAC, and this A stands for antenucleus. So that means something input is coming into the antenucleus, and then it is going output into the this C, and this input M stands for mammillary body, and this C stands for cingulate gyrus. So it is coming from the mammillary body, relaying in the antenucleus, and then going into cingulate gyrus. Coming from mammillary body, relaying into antenucleus, and then it's going into cingulate gyrus. Okay, now after this, these last two remaining is we need to know what is the input and output for lateral geniculate body, what is the input and output to the medial geniculate body. It is very simple. See, medial geniculate body, M stands for music. So medial geniculate music, it is music, music, music. Okay, so M stands for music. So medial geniculate body is music, and lateral geniculate body L stands for light. So lateral geniculate body is associated with the vision. So basically you have to know this is lateral geniculate body is associated with the vision, and medial geniculate body is associated with the audio, your hearing. So input and output, it is very easy if you know what are the tracks of visual system and auditory system. Auditory system, where does it end? What is the output going into which part of cortex? It's called as primary auditory area. And and this visual system, what is the output? Again, what is it? It's called as primary visual cortex. It's primary visual cortex. Primary auditory cortex is the output from lateral geniculate body and medial geniculate body. Now you need to know what is the input. It's very simple. Lateral geniculate body, I told L for light. Light means vision. And what is the input coming from? It is coming from optic tract. Vision sensation coming from optic tract. You can even tell optic, no problem, but optic tract is the standard. Now medial geniculate body, what is the input and what is the output? Now M stands for music, and the input for music, for hearing, is coming from inferior colliculus. And one important last point about thalamus which I would like to tell is about something, a syndrome called as thalamic. It's called as thalamic pain syndrome. Okay, it is called as thalamic pain syndrome. Now in this, if there is a lesion in the thalamus due to inadequate blood supply, patient will have hypersensitive to pain. Just like girls, you touch them, maybe sisters, you touch them, they'll shout, oh, he hit me, like that. Okay, they don't have much pain, but even if you touch them, they feel as if you're like amputated their limb. Okay, now that is called hypersensitive syndrome, also called as thalamic pain syndrome. The basic clinical features of this is patient will be having hypersensitive to pain. Second thing is even some emotions or even taking a hot water bath, they get extreme pain. Okay, and this was about thalamic pain syndrome, and this it was about thalamus.